Greetings, friends and followers. Good morning. This is Dale Barcy with Nurses Talking. As always, if you like what you see and hear, give us a like, subscribe. Today, my guest is Lisa Anne Holt. Lisa is a registered nurse, a home health transformation expert, a corporate trainer, and an author. So thank you, Lisa. Welcome.
You're welcome. Thank you so much for having me. I'm really excited to have the opportunity to talk.
I'm excited to have you. I love talking to nurses. So that's always my first thing. Why are you a nurse? What drew you to this?
Well, to be perfectly honest, I've been a nurse now 32 years, I believe, this year. I had no interest in being a nurse. I was not one of those little girls who grew up just wanting to be a nurse at all. My mom was a nurse, so I saw how hard she worked and I admired what she did. She went to nursing school, though, way back when you could specialize and not generalize as a nurse. So she went to school in New York City at the New York Foundling Hospital and only learned maternal and child nursing. So when she left nursing to have her children and stepped away from her career, the rules changed and she could no longer keep her nursing license because she didn't have the full generalist training that nurses have to be licensed. So that always bugged her, and nursing was always in her heart. And so as I came to the time where I wanted to go, I was going off to college, and I knew I needed to make some money to be able to make it through college because I was not born with a silver spoon, unfortunately. I know, wouldn't that be nice? But it was not so. I wanted to be a doctor, and I was a pre-med student and studying madly away to become a doctor. But I knew I needed money. So my mom said, "Hey, I just found out about this LPN program. And why don't we check that out together? I'll go back to school and become an LPN. You can do it. It's only a year program. You can do it, and then you'll have, you'll a foot in the door in the hospital. You'll see what it's all about, and you'll be able to pay your way through medical school." So that sounded like an okay plan. She also convinced me along the way to become a CNA. So I also did CNA work to be able to pay for the LPN program. So I think mom just kind of tricked me into getting into nursing. So I went off to LPN school with my mother. We sat next to each other at a hospital-based LPN program many years ago now. And at the same time, I was taking night classes at university. And working on the weekends as a CNA. So I never slept. That should have prepared me for my early days of nursing quite well. Yeah. So anyway, along the way, I realized how much I absolutely loved nursing. And I also realized that medicine wasn't where I wanted to be. That really where I wanted to be was nursing. And then I left behind the pre-med field and went on and got my associates in nursing, my bachelor's in nursing, master's degree. And I finished my curriculum for my PhD, but I'm all but dissertation on that. So anyway, that's how I became a nurse, not because I wanted to, but just because once I got into it, wow, what a career.
You wanted to, you just didn't know it. Thanks, Mom.
Mom knew.
That must be awesome, going to school with your mom.
Well, if I can brag a little bit on my mom, we ended our courses with the day that they were going to tell us what our class ranking was, because we're coming up on graduation. We found out that I was valedictorian, but my mom was salutatorian. So we studied really well together.
Yeah.
And made it through.
Awesome. I love that story. So in what areas did you work then after that?
Oh my goodness. Well, I started off in medical psychiatry right
Okay.
out of nursing school. And then kind of shifted from there into substance abuse, but obviously still in
Yeah.
behavioral health.
Yeah.
And then along the way ended up in home health, pediatric home health. And I found that my mental health, behavioral health background really helped with that because I was working with medically fragile children at home on ventilators, really
Ah,
sick kids,
yeah.
and 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 obviously the strain and stress that that puts on a family
Yes.
affects everybody's mental health status. So I found that actually was a nice mix.
Mhm.
Plus, it boosted my nursing skills quite tremendously.
Yeah.
Um, and then along the way after that, I had one too many of my babies die, and I decided I needed to have a break from pediatrics and went into Medicare certified geriatric home health instead. And that kind of, even though I have spent most of my career in leadership and in nursing administration and hospital administration, home health administration, my clinical love has always now had become Medicare certified home health and hospice care.
Awesome. Awesome. That's a lot. That's
And
a lot.
I've had enough years.
Yeah, but it's very wide, it's very varied, you know?
Yeah,
And
well,
that
and most recently, I've actually been working as a nurse entrepreneur and doing consulting and coaching and helping other leaders develop and transforming their businesses. So, again, nursing I find to be a fabulous career because the sky's the limit. If you have a nursing license, you can do anything.
you can do anything. You can do anything. And so I'm glad that you brought in this entrepreneur thing because I was going to ask you what exactly is home health transformation?
Sure. Well, home health transformation to me means walking into a home health agency, Medicare certified home health agency, and doing a rapid assessment of what's wrong. Many Medicare certified agencies really struggle with their operations and their funding streams and making sure that they can keep up with all of the constant regulation changes, a very, very rapid change in home health, even more so, I think, than the hospital setting.
Yeah.
Um, so because of having to keep up with that, it's daunting. Um, a lot of Medicare certified agencies are owned by hospital systems, and hospital systems don't know how to run a home health
Okay.
agency. Sorry,
Mm-hmm.
hospital systems, that's the truth.
Mm-hmm.
They can't run it like they run a hospital.
Exactly.
Um, so for many years, I was hired by hospital systems to come in and transform, turn around their failing agencies. They might have been on the brink of bankruptcy, many of them were,
Mm-hmm.
um, and they just didn't know how to make it work. And my job is to come in, see what's wrong, and fix it fast because we don't have the luxury of time.
Yeah. Yeah.
And it's super important because home health in your community is a vital partner. Many people may not be aware of that, but
Yeah.
home health is essential and vital. It's critical to the community.
Yeah.
So we got to get them successful.
Indeed, indeed. And as you said, many people may not be aware of it because it's kind of like silent almost.
Yeah.
Yeah. I get that. I get that. I get that. And so I see that you also wrote a book. And I looked
Yeah.
at the title. It's a long title, Lisa.
Yes,
Six
it is.
Impossible Things Before Breakfast, Creating a Culture of Yes in Your Healthcare Organization.
Yeah.
Wow.
I know. It's a mouthful.
Tell me about that.
Well, Six Impossible Things comes from a quote by Lewis Carroll, and it is in Through the Looking Glass.
Mm,
For those who don't know the books, it's in the Alice in Wonderland book. It's the second of those books. And I think everybody probably culturally knows who Alice was, or Alice in
Mhm.
Wonderland was. A little girl who fell down a rabbit hole and kept falling and kept falling and kept falling into this magical, bizarre, weird, freaky world that she had just magnificent, marvelous, and sometimes very scary experiences.
Mhm. Mhm.
So that one section of the book that talks about six impossible things before breakfast is when she's talking to the queen, another character in the book. And at one point, Alice said, that just can't be, or I don't believe that. Well, then you haven't tried hard enough, she says. The queen says back to Alice, why, when I was your age, I often believed as many as six impossible things before breakfast. And that quote really resonates with me. I reread these books that I actually hated as a kid. For some reason, I picked them back up when I was recuperating from having stage 4 head and neck cancer.
Wow.
Um,
Mhm.
I had lost half of my tongue. I couldn't speak. I lost 34 lymph nodes in my neck. I was on death's door. I was laying in a bed and I did for probably about 18 months to 2 years where I really was detached from the world. And it was in that time frame where I was preparing for the end of my life. I had been told I had a 3 to 5% chance of survival over 5 years. I was young, I was 35. Actually, this is the anniversary. Funny, we're talking today. It's the anniversary of 16 years ago receiving the
Wow.
diagnosis.
Wow.
And and I picked up these books again while I was laying in bed. And I don't know why, but when I read that quote, it inspired me to start reframing my mindset. And instead of just accepting this inevitability that I wasn't going to speak again, I wasn't going to eat normally again, that I was probably going to die, I instead decided that nothing is impossible. And if this character in the book could believe six impossible things, then I could believe six impossible things and I could believe them into existence. So I mastered talking again. As you can tell, I talk a lot. I do that well. I, I became a public speaker after this with half of a tongue. I don't know
Yeah.
how that happened. But it also then started as I recovered and I was able to get back into the workforce. It informed how I operated in business because no longer would I accept somebody's no. I wouldn't accept that that's impossible. We can't do that, which we hear a lot in business and in healthcare in particular. No,
Yeah.
we can't do that. We can't do that. We're understaffed and too high of a census, and we don't have the funding, and all the excuses for why you can't
Yeah.
take care of your patients
Yeah.
the best way you should.
Yeah.
So that's why I wrote this book, and that's why the title, Six Impossible Things, and creating a culture of yes in your healthcare setting. So it's a fairly quick book. It's a very easy read. I wrote it intentionally so that because healthcare people are very busy.
Yeah.
I wrote it intentionally to be very brief um, and share those experiences that I had of taking that philosophy and applying it into a healthcare setting to get amazing results for people.
You just gave me all kinds of goosebumps, you know.
I think that's a good thing.
Yeah, that was a good thing. Well, I was going to ask you, well, I maybe still will ask you, what would you say is your greatest achievement so far? Because, I, yeah, wow.
Well, um, I think some of the things I'm most proud of, and another area that nurses can really shine, is some of the humanitarian work that I've done. I was very fortunate early in my career. to become the chief executive officer as a nurse for a children's charity called Healing the Children. And the Florida, Georgia chapter was my area. And I'm really proud of the work that my team and I did to be able to transform children's lives, and children's lives both here in the United States, but also abroad. Most notably, my organization was recognized by Oprah Winfrey for the work that we did with acid burn victims coming in from Bangladesh. We took in some little girls who had been horrifically damaged, required multiple surgeries to at least retrieve some of their prior looks. Of course, as one of our donating surgeons said, only God can make a perfect face, but I'll do my best.
Yeah.
And he did amazing work.
Yeah.
And what's so, I mean, that was great. And I would call that probably one of the, that was my 15 minutes of fame. But what really is special about that story is the little girl that is talked about and presented and is on the Oprah Winfrey Show became a nurse. She became a US citizen. She became a nurse. And now I mentor her. And I love having that interaction with her. So from, the little child I knew at 9 years old.
Yes.
Is now an RN and giving back. And I think that shows the power of what we can do with kindness.
Yes.
And persistence.
Yes.
And we can change the world. And nurses are perfect for that.
Nurses do change the world.
Yes, we do.
We do change the world. Wow. Okay, so this is I think I'm going to title this conversation we have the goosebump stories, because this is awesome. So having done all of this and having experienced all of this, overcome the challenges and whatever, what kind of advice would you give to someone who wants to become a nurse?
Well, nursing is, as I've said, a phenomenal career. I highly recommend it to anybody out there. If you're just starting out and you're trying to navigate through all the prereqs and all of the hoops that you have to jump through for nursing, understand that it is really worth it at the end of the day. But also keep in mind that there are also other members of our health professional team too. And if nursing ends up being too much of a challenge, because nursing school is really, really hard and very, very demanding and very selective, and making through nursing school is probably one of the hardest things that someone can do. If you find that for whatever reason, you're not able to get through, there are other health allies that we need as part of our care team. So don't give up on healthcare if that was the case. Occupational therapy or physical therapy or lab techs, the sky's the limit.
All just as rewarding.
Exactly. But if you are able to make it through nursing school, gosh, do it, because boy, doors open for you like you would not believe.
Yeah.
But you gotta be resilient, and you gotta be able to bounce back and never lose the kindness in your heart that brought you to nursing school in the first place.
Okay. And so I've been collecting these words. I've been collecting words. I asked nurses, what would they say if you had to describe the most essential quality of a nurse in just one word? What would that word be?
Resilience.
Resilience. I thought it would be, you just mentioned it. Yeah. Yeah. So Lisa, I know that you're now based in Sweden.
Yes.
So what kind of challenges did you face? What kind of adjustments did you have to make?
Well, I came to Sweden in a kind of weird way. So definitely good thing I was resilient and good thing I had that background, um, because I had to master a whole lot of change really fast. I had fallen in love with a wonderful man in Sweden who is Swedish and grew up in Sweden and had never intended to leave Sweden. And he also has a minor child as well. So he has
Right.
reasons that he needs to stay in Sweden, where my children are grown adults and no longer needed me physically there in the United States. So I had planned, um, we had planned together for me to relocate to Sweden at the probably September is what we were thinking, September of 2020. So that's a process. I had to apply for my residency permit. That could have taken years. We really didn't know. But somehow things worked out that right before the pandemic hit,
Mhm.
I had my interview with the embassy in Washington, and I met with the Swedish embassy. They granted my permit, and I knew I had to move within 6 months. So we had planned for 6 months that I would be moving. I As soon as I got my notification, I went to my boss because I had a very hard to fill position and I wanted to help them find my
Okay.
replacement.
Mhm.
So I told her immediately. And I started packing things in my house, but I wasn't planning to move for 6 months. But I did have a planned 1 week vacation in the end of March, just for 1 week. I was going to come to Sweden. I was going to be right back home, back to work, back to my life there in the United States, and continue our plans for me to move to the end of the year. Well, as I left at the end of March, my on my air flight over to Sweden, I got a text from the airline canceling my return flight home. Like, okay, well, that's going to be a problem.
Yeah.
And of course, as you all know, that's all history now. Borders slammed shut. Airlines were not flying. I could not get back home. Even if I wanted to, it was physically impossible. So I left behind my condo, my car, my belongings, my cat, my job, everything. And I have not been back to the United States since. So talk about what you asked me, what that was like, what I had to do to change
Yeah.
a lot. So I had to figure out how to make logistics happen. But remember, nothing is
It's
impossible.
impossible. I know. Yeah.
And sure enough, I found someone to adopt my cat. My mom helped me get my car sold. I sold my condo from a distance and was able to do that somehow. I don't even know how, but we figured it out. Um, I started taking Swedish classes so that I could at least get working proficiency in the language. That's always a work in progress. It's a really tough language. Um, and I started my own consulting business and wrote a couple books. So I've been busy since I moved here.
Wow. You are such an inspiration in all of this. In all of this, you talk about, you know, overcoming the impossible.
Yeah.
And, you have come back from huge challenges. So one of the things I always speak to nurses about and ask about is self-care. What does it mean to you then?
I used to be horrible at self care. And I am acutely aware of the importance of it because I became very burned out in one of my positions. And burnout is no joke. Chronic workplace stress is a killer. It
Hmm.
is a chronic, horrible problem, especially in the United States
Hmm.
and especially amongst healthcare workers.
Yeah.
So I'm particularly passionate about that topic. What I learned from that experience was the importance of setting boundaries, And it sounds easier. It's easier said than done, and I get
Yes.
that.
Yes.
It takes practice, um, but it takes prioritizing yourself. I used to be the type who would say, I have to be there for everything. You know,
Yeah.
I was in hospital administration and was on call 24/7, quite literally
I know.
for years.
Yeah.
And it was in that role that I just became completely overwhelmed with the stress. One day it just didn't work anymore. So in my next job, I set boundaries from the beginning. I was never going to work past okay, maybe 6 p.m. if you really needed me to,
Yeah.
for some urgent meeting. But I never worked weekends. I never checked my phone, my emails after I left the office.
Yeah.
When I was done with work, I was done with work.
Yeah.
And a lot of people say, well, then they're going to think that you aren't committed or you're not working hard enough. But you know what? My outcomes were just as good,
Yeah.
working,
Yeah. Yeah. Yeah.
not
Yeah.
better.
Yeah. It's a fallacy that if you're working longer, you're working better. It's
No,
not true.
right. And if you ask a busy person to get things done, they'll get done.
Look
They'll
at that.
figure it out. But you have to figure it out with still leaving time for yourself, for your relationships, for nurturing you. Because without you, if you don't refill that bucket, there's nothing left to give.
Yeah, I know, I know, I know. And in many instances, people are conditioned to think, or we're conditioned to think that if you are the first one to get there and the last one to leave, you are the best one. And that
I
is,
felt that.
I used to tell people when there was a time when I was still working full time and working that, I was in nursing administration. That is something I always said in an interview. I am not impressed by
No,
you being the first one there and the last one to leave.
right.
What it tells me is that you're not managing your time properly.
Yeah.
So, don't do it for me, please. Yeah.
Well, and something that is I'm very active on a number of entrepreneur and nursing entrepreneur boards on social media, and that's kind of a common thing I'll hear, especially from a newer entrepreneur, that when you're listing out the pros and cons of being your own boss, um, I hear way too often, like, the bad thing is you're on 24/7. And I always say, well, then you're doing it wrong,
Yeah.
because I don't work 24/7.
Yeah.
I enjoy life now. I enjoy spending time with my family. I enjoy my hobbies. No, you don't have to work 24/7.
Yeah. Yeah.
If you're doing that, you're doing something wrong,
Yeah.
and you will not be able to do it forever.
Yeah. Yeah. That's what we learn. That's what we
Yeah.
learn. Yeah. I was one of those who tried to do it all the time, and I learned that the hard way, but I learned that.
Well, and I think nurses are particularly vulnerable
Yeah.
because we're helpers, aren't
Yeah.
we? I mean, that's why we go into nursing, and we can't even stand the thought of not helping. Well, you're not helping if you're exhausted.
Yeah. Yeah. So if you have a vision for nursing and nurses and nursing going forward, what would that vision look like?
Ah, well, honestly, since I moved to Sweden and I've engaged with the healthcare system here, and I compare it to the healthcare system I spent, over 30 years of my career working and participating as a patient in, especially think about my cancer time and how that financially devastated me. A person with health insurance wiped out all my savings, wiped out my retirement account, jeopardized my future financial security, as well as having to deal with day to day making decisions about, do I pay for my tube feedings, or pay
Yeah.
pay the mortgage,
Yeah.
because, by the way, tube feedings, even though they're necessary to sustain your life, weren't covered by my insurance and are ungodly expensive. But anyway,
You know.
um, and I think about the drug costs and everything that went into that diagnosis to keep me alive. Um, certainly thankful I could do that, but there are a lot of people in the United States and in the world who cannot do that.
Yeah. Yeah.
And when I moved to Sweden, I engaged in the healthcare system my first week here. I probably all the stress of travel, etc. I ended up with an infection and I knew I had to get it treated. Something like that, you can't just leave. And
Yeah,
I knew.
exactly.
So I dreaded having to go to the doctor, to the urgent care, because I wasn't insured yet. I didn't have my person number. I didn't have my card.
Yeah.
And I knew I was going to have to pay full price. And so I was scared. I didn't know how
Yeah.
to pay this stuff.
You're thinking, here we go again, huh?
And in the United States, I mean,
Yeah.
what kind of cost that can.
That would be, yeah.
Hundreds and hundreds and hundreds of dollars by the time you're done.
Yeah.
Well, so I walked into the doctor's office. There was no receptionist. I logged into a kiosk on the computer, and I thought it was really kind of odd. There was no reception. There was a seating area, and there was a little sign that said, after you finish here, you'll sit there. So I followed the rules. I went and sat there. And then a gentleman came out from a door and called me back. And I thought, oh, okay, he must be the nurse, MA, something. No, he was the doctor. I thought, okay, well, that's strange. He took my history. He did the exam. There was no telling my story to 5 people along the way.
Yeah.
I said, well, hey, while I'm here, great that you're giving me antibiotics, but might as well make the most of my time with you. I need a refill on my Synthroid. Is that something you could do while I'm here? He's like, well, do you have proof that you have
that you're on
Well, yeah, I do. And so I pulled up my chart from the United States on my phone and I showed him. And he was looking through my chart and he said, why in the world did they chart all of this? What? Every visit they chart all of this? Oh my God, I would never be able to get my job done. I'm like, if we could just fire. So anyway, he then walked me, he said, fine. He wrote me the scripts I needed in the computer. And he said, okay, I'm so sorry about this. And he was looking at pricing for me on them. He's like, I'm so sorry. I know you don't have insurance. I know this is going to be really expensive. I'm so sorry. I'm like, oh, I understand, whatever. I understand. And he said, but, and also I need you to go to the lab and I'm going to, I have to have, documentation for why I'm giving you antibiotics.
Yeah.
So he walked me personally to the lab, handed me over to the lab. I'm not sure what level they were, but a lab tech. They took the samples they needed, and that person walked me over to the pharmacy. I still have not seen a front desk back office person yet. I've only engaged with health professionals on the way. Not that they're not, what I mean, licensed clinicians.
Yeah, exactly.
So then I walked into the pharmacy. They pulled me up in the computer, and a pharmacist themselves reached over behind her and took out a box that was all prepackaged and slapped a sticker on it. That was with my name. No counting out pills, and which I always wondered why we do that. Handed me that, asked me if I had any questions, and gave me the bad news of how much I owed. $20 for the doctor, for the lab, and for the medication that also included my Synthroid. And I was supposed to be appalled at this. If I take allergy medicine, a good example that will probably resonate with people who buy. So I buy Claritin or Loratadine. Here, I don't even know what it costs anymore in the United States because it's been a while since I bought it. But here, it is literally $1, one or a little more than $1, or a little less than $1 actually, 1 sec for 30 pills. how is it that it can be that way here? I have my taxes paid for my health care. I don't pay a deductible. I don't pay, and there's like a small, very small amount that apparently if I went to a specialist, I'd have to pay, but
Okay.
negligible amount. But I don't have to pay for a $5,000 deductible to be able to go to the doctor.
Yeah.
People here don't go bankrupt. So
Yeah.
my vision for healthcare is that the United States blow up the healthcare system and get it right, because I'm sure Sweden's healthcare system isn't perfect. I'm sure, the UK's is probably not perfect. I'm sure there's room for improvement,
Yeah.
but wow, it's a heck of a lot better.
Yeah.
It's
It's
a heck
not
of a
like
lot.
there isn't room for improvement here. So
Exactly.
yeah,
So, I think that there has to be a world where healthcare does not put people in the poorhouse, and
I
people
know.
don't have to make the decision between feeding their family and affording their insulin.
Yeah. Yeah.
And I think
Yeah.
that's
Yeah.
inexcusable.
Yeah. That's unconscionable. I can't even, I don't even want to wrap my mind around it because
No.
it's a lot of what happens is unconscionable. But anyway.
Yes. Yes.
Well, anyway, let's be a little bit brighter. Lisa, thank you. Thank you so very, very much for doing this. You're such an inspiration, I have to tell you. So thank you
Um,
so much for this goosebump conversation. Thank you.
thank, thank you for having me, and I've been really delighted to have the opportunity to meet a fellow nurse. I always appreciate that. And if any of your subscribers want to ask questions or carry on the conversation, I'm always open to that. I love talking to nurses.
Me too. So thank you so much.